GOLDBERG, it's time to shake up Canada's failing healthcare status quo. Canadians are frustrated with a lack of primary care, long wait times in emergency rooms, not enough specialists, and crowded hospitals. And rightly so. But for too long, politicians have tried to solve these problems by throwing more money at Canada's healthcare system without pursuing fundamental reform. For example, public healthcare spending per person increased from $5,300 in 2000 to $8,800 in 2023, after accounting for inflation. Yet the more money Canada's politicians have thrown at the system, the more problems Canadians face. Take just one statistic from the Fraser Institute. In 2024, 50% of Canadians waiting for a planned medical treatment were stuck waiting more than 30 weeks between referral and treatment, the worst delay in decades. It's time for Canada's politicians to recognize a hard truth. Our universal healthcare system won't be fixed until Canada adopts lessons learned across Europe, including incorporating private care into the universal healthcare model. That's not to say Canada should embrace the American model, where tens of millions are uninsured. Canadians don't want to take the American approach. But there are other models Canada could look to follow. Too often, Canadian politicians just point to the United States and claim that anyone looking to reform the system is putting Canada on a fast track toward American-style healthcare. Yet Canadians should look to a country like Switzerland, with universal coverage and far better outcomes, instead. Why Switzerland? Both Canada and Switzerland spend just under 12% of GDP on healthcare, according to the Fraser Institute. Yet 94% of Swiss respondents said they were satisfied with their country's healthcare system, compared to just 56% of Canadians. Why are the Swiss so much more satisfied with their system? Switzerland has more doctors and nurses per person, better access to care, shorter wait times, and lower unmet patient needs. Consider just this one statistic on wait times. In Canada, only 48% of patients are able to see a specialist within 2 months of referral. In Switzerland, that number is north of 85%. Clearly, Switzerland is getting things right while Canada is getting things wrong. In Switzerland, citizens choose the health insurance that's right for them. There are 44 competing private, not-for-profit insurers. Everyone must enroll in some type of coverage, but everyone also has the freedom to choose the insurer and degree of coverage that fits their needs. While patients do pay some money out of pocket, more than 25% of Swiss citizens receive subsidies from the government to help pay for their insurance, allowing those less well-off to still access a solid insurance plan. Even basic coverage in Switzerland is better than basic coverage in Canada, including mental health care, medications, home care, and long-term care. Canadians must pay through the roof out of pocket for things like me.